over-the-counter na pag may kunwari may lagnat or sumasakit ang tiyan or sumasakit yung pag after ng umihi, sumasakit, ganyan, is nagtitake sila ng mga, most common is, ang binibili nila, diba, is amoxicillin. Okay? Which is, of course, not proper na i-take pag meron kang urinary tract infection. Because remember na, meron tayong mga specific medications meant for specific disorder. Okay? Yan. So these are the most common nursing interventions. Okay? The next topic under the second topic is undescended testis or yung tinatawag natin na cryptorchidism. Okay, guys, this condition, guys, is very common among preterm. Okay, kasi if you read your book, okay, especially sa NCM 107, okay, diba, ang pag-descend ng testis usually occurs at what specific month? Kailan nagdi-descend ang testis? In the scrotal sac. Kailan nagdi-descend? Anybody from the group? During fetal development muna tayo, ha. Wag niyo munang i-consider itong 75% ganyan. So, during fetal development, when do we usually expect the testis to descend in the scrotal sac? Kailan, guys? At what specific month? Ano po, hindi naman kayo nagre-recite, ha? Okay. Start ako sa baba. Miss Villa Flores. When do you expect the testis to descend in the scrotal sac? First month, fifth month, seventh month, ninth month, ano ba? Kailan? Miss Villa Flores.
Ma'am, 8 months.
Are you sure?
9
Yeah.
pala, ma'am, 9 months.
Ha? What is your reference for that? Is it your military book? Miss Villa Flores?
Ma'am, wala pong book. Sa ano lang, ma'am, nag-search po ako.
Nag-search ka lang. Okay. So guys, remember that the testis usually descends in the scrotal sac on the 9th month. Kaya nga sinabi ko sa inyo kanina that this condition, cryptorchidism or undescended testis, is common, okay, for preterm deliveries or preterm babies. Okay, so for your general information, so this is a unilateral or bilateral absence of testis in the scrotal sac. Okay, I repeat, this is a unilateral or bilateral absence of the testis in the scrotal sac. Hindi po sinabi dito na absence of testis, ha? Absence of testis in the scrotal sac. Kasi during assessment, if you're going to palpate or assess the scrotum, okay, wala ka pong makakapa doon na bilog dahil nga hindi nagkaroon ng descent ng testis in the scrotal sac. Remember, guys, that the scrotum is the one that covers the testis and protects it from the outside environment. Diba? So, napaka-importante po yung function ng scrotum, okay, sa reproductive life ng mga lalaki. Okay? So, the testis normally descends at 8 months of gestation, pero there are also other books that says na 9 months. So, pag below 9 or below 8 months, okay, 7, 6, 5, or mas mababa pa doon, okay, they may have this condition which we call the undescended testis. Okay? So, I hope na when you will have your duty in the hospital during the first semester, let's hope for the best, guys, kasi until now ay naka-level 1 pa din tayo. So, hopefully, until August onwards, ay level 1 pa din tayo. So, you can already have your duty in the hospital after your capping. Okay? So, the incidence increase in children having genetically transmitted diseases is also high. So, incidence increased in children having genetically transmitted diseases. So, this is also associated with genetic disorders. Okay? So, sabi nga natin kanina, previously dito, it can be unilateral or bilateral. Pero, okay, based on research, okay, based on findings, okay, ang most common is unilateral cryptorchidism. Or yung pag sinabi nating unilateral, yung isa lang ang nawawala during palpation. Yung isa, meron sa scrotal sac, pero if you're going to check the other, okay, nawawala po or absent yung testis dito sa kabilang side. Okay? So, 70% will descend, 70% will descend spontaneously by age 1 year. Okay? So, ito po yung inaantay nila before surgery will be done. Or bago nila sabihin sa nanay na ang baby kailangan niyang or yung infant, kailangan niyang mag-undergo ng, okay, anong specific procedure guys ang ginagawa to correct cryptorchidism? Ano yung surgical procedure na yon? Kunwari, 1-year-old na yung bata, pero during physical examination, hindi pa rin makapa ng kanyang pedya yung isang testis. Okay, what specific procedures should be done? Okay, to correct the condition para pababain yung testis dun sa isang scrotum. Miss Vigilia. Anong surgical procedure yun, Neng? It starts with letter O and ends with letter Y. Miss Vigilia?
Ma'am, sira po yung mic niya pero nag-chat po siya sa...
Sorry guys ha, kasi hindi ko na nakikita once na nakapana ako. So, anong answer niya? Please read it for me. Nababasa niyo ba guys?
Orchiopexy po.
Okay. So, it's orchipexy. Okay. O, may mga, pag nag-search ka kasi sa internet, ang masa-search mo dyan is orchiopexy. Pero it should be orchipexy. O-R-C-H-I or P-E-X-Y. So that is the surgical procedure na ina-undergo ng mga bata na mayroong undescended testis. Okay? And syempre guys, kailangan na i-correct natin yung condition na ito kasi remember, if they have this condition, if you're not going to correct this condition as early as possible, okay, it can affect, okay, the ability of the child to ano yung i-apektuhan niya later on? Kung hindi, kunwari, hindi nag-design yung isang testis. It can affect the child's ability to reproduce. Kasi remember guys, di ba? Mainit sa loob ng katawan natin. Especially like for example, okay, parang ito guys, meron tayong abdominal, inguinal, okay, and supraescrotal. So, pwedeng dyan mo makikita, okay? Dyan yung mga areas kung saan nandoon yung ating testis if it will not descend in the scrotal sac. Okay? So, remember guys that the body temperature, of course, inside the body is higher compared to the temperature if the testis is inside the scrotum. So, pag masyadong mainit, what will happen to the sperms being produced? Siyempre, okay, mamamatay sila. Some will die, okay, some will not grow normally, which can affect later on the ability of this person or this child to reproduce. Kaya later on, nahihirapan mag-conceive yung asawa just because of this condition. Though sabihin na natin na they actually produce millions of sperms, pero syempre, hindi naman lahat po yun ay nag-grow normally. Okay? Kaya napaka-importante na kailangan natin i-correct yung ganitong condition. Okay? Yan. Okay, so, if you notice guys, itong biniligan ko dito, ano yung nanonotice nyo dito sa nabilugan? Kasi for sure, ang makikita nyo agad is, parang dito sa part na to, walang laman agad. Pero take a look at this guys. Oh. Okay, sorry. Ayan. Okay. Ano nakikita nyo dito sa part na to? Steam ball. Steam ball. Ano nakikita mo sa part na to, Neng?
Ma'am, nag-i-inflame. Inflame po.
Okay, inflamed or parang may mass that is present in the inguinal area. Diba? And then if you take a look at the scrotum, okay, in this part, okay, at this part, sa may left, scrotal sac, diba? Wala siya talagang laman. Okay? Kasi diba parang, ano tawag mo dito, yung hindi gaya dito na globular, ito naman is talaga manonotice mo agad na absent ang kanyang testis. Okay? So, ibig sabihin, hindi siya nag-descend in the scrotal sac. So, gaya ng nandito na sa part na to. So, sa previous picture, okay, we can say na, okay, nandito siya sa part ng pwedeng femoral or pwede dito sa superficial ectopic part. Eh, hindi siya totally nag-descend in the scrotal sac. Okay? So, what will be the medical management? Okay? So, whether or not to treat is still controversial. Pero syempre, sabi ko nga kanina, since it can actually affect the ability of the child later on to bear a child or to reproduce, we really have to correct this. So, if the testes remain in the abdomen, damage to the testis or specifically sterility is possible because of increased body temperature. Okay, if not descended by age 8 or 9 months, guys, chorionic gonadotropin can be given. Okay, and the surgical procedure, okay, that should be performed is what we call orchitexy. So this is surgical procedure to retrieve and secure the testis placement in the scrotal sac, which is performed between ages 1 to 3 years old. Okay, hindi naman agad-agad guys na pag kunwari, ikaw ang nag-newborn care and then suddenly the doctor said, okay, guys, tignan nyo, merong undescended testis yung batang ito or yung newborn na ito. Hindi naman agad-agad, ipiprepare na siya for surgical operation. Okay, syempre, remember guys na meron tayong mga protocols prior to surgical operation and we really have to follow that. Okay, kaya nga sa mga bata, specifically for this procedure, okay, we really have to wait for this specific age, either between 1 to 3 years old before they will perform the procedure. Okay, kasi sabi nga natin kanina, di ba, na kahit na meron siyang undescended testis at the time of birth, okay, pwede pa din siyang magkaroon ng mag-descend, pwede pa din mag-descend yung testis, okay, at a maximum of 1 year of age. So, antayin muna natin yun. Pero kung wala talaga, that's the time na, syempre, kailangan ng kausapin ng doctor yung parents that the child should really need to undergo orchitexy. Okay? Actually, this is not related, pero ma-share ko na lang din. Di ba, sa mga bata din, very common din ang hernia. Okay, when we say hernia, yung nagkakaroon ng protrusion of abdominal contents dito sa may mga, sa may inguinal area. So, this could be due to yung very weak na abdominal muscles, okay, na nagkakaroon ng protrusion ng either large intestine in that part. Okay, so yung aking pinsan kasi noon, when she was, babae ito, when she was, I think, 7 years old, so parang grade 1, nagkaroon na siya ng hernia. And then, syempre, kailangan din ito i-correct. So, nag-undergo siya din siya ng operation. Okay? So, syempre, kasi sa mga ganitong condition, guys, kailangan natin i-correct yung mga yan to prevent further complications. Okay, so ulitin ko, the surgical procedure for undescended testis is orchipexy. Okay? Para mailagay natin yung testis in its proper placement, which is in the scrotal sac. Okay? So this will be the assessment findings during a physical examination. So dito guys, pwedeng ang doktor ang gagawa or pwede din naman tayo ang gumawa, di ba? Kasi alam nyo naman na pwede tayong gumawa ng or mag-perform ng head-to-toe assessment. And if you still remember, that is part of your activity when you had your head-to-toe assessment. Okay, nung first year pa kayo. So, ano yung mga kailangan makikita natin? Assessment findings. Number 1, you will be unable or the nurse is unable to palpate testis in the scrotal sac. Okay, so there is absence of either one or both testis in the scrotal sac. Wala ka pong makakapa na bilog. Okay? Siyempre sa mga girls, for sure naman, alam nyo kung ano yung pinag-uusapan natin dito. Okay? Huwag kayong pa-inosente girls, ha? Okay? So parang bilog siya, makakapa mo na parang itlog doon sa loob ng scrotum. Okay? So dapat bilateral. Dalawa, dapat ang bilog. Okay? Pero kung nakapa mo doon, iisa lang, tapos yung sa isang scrotum, wala kang makakapa na bilog, ibig sabihin, okay, merong unilateral cryptorchidism yung patient mo. Okay guys, wait lang ha. Biglang nawala. Okay, pag-rejoin, ay magkuhan na lang ulit, mag-join. Biglang nawala, sorry. Okay? Another assessment findings, when palpating the testis, reminder, when palpating the testis, be careful not to elicit cremasteric reflex. Okay, guys, how are you going to elicit cremasteric reflex? Paano natin ini-elicit ang cremasteric reflex? Miss Tapia. Paano natin ini-elicit ang cremasteric reflex? Which sabi dito, when you are doing head-to-toe assessment of the testis, okay, huwag mo dapat daw ma-elicit. Be careful not to elicit the cremasteric reflex. Okay, ano ang cremasteric reflex, Miss Tapia?
Ma'am, yung cremasteric reflex po is a superficial reflex that is elicited when the inner part of the thigh is stroked po.
Okay, if you stroke the inner part of the thigh, okay, ano ang mangyayari?
Yung cremaster muscle po, ma'am, magko-contract and pull up the testicle toward the inguinal canal, ma'am.
Okay. Tandang mo dito, if you're going to stroke the inner part of the thigh, okay, the cremaster muscle will be, wait lang guys, sorry, may mga text messages na naman guys, sorry po, saglit lang. Okay, so going back to cremasteric reflex, sabi ni Miss Tapia, okay, the cremasteric reflex is a superficial reflex found in human males na pag in-stroke mo yung inner part of the thigh, okay, it will cause the cremaster muscle to contract, okay, and pag nag-contract yung cremaster muscle, it will pull up the ipsilateral testicle toward the inguinal canal. Okay, so guys, make sure na if you're going to assess the testis, wag mong hahawakan yung inner thigh ng patient mo. Okay, para hindi mo ma-elicit yung cremasteric reflex. Okay? Guys, saglit lang ha. 5 minutes break lang tayo guys, saglit lang po. Okay? So, for the nursing interventions, you have to advise or to do the following. Number 1, advise parents of absence of testis and provide information about treatment options. So, syempre, as nurses, di ba? Since alam na natin na later on, the child, just in case, pag nag 1-year-old na yung bata, ay hindi talaga nag-descend yung kanyang testis, okay? Definitely, we will inform the parents kung ano yung mga mangyayari later on. Like for example, okay, that the child will undergo a surgical procedure to correct the condition. Para as early as possible, ay ma-orient mo na sila kung ano yung mga kailangan nilang i-prepare at kung ano yung mga kailangan nilang gawin. Because remember guys, pag ang isang bata mag-undergo ng isang operation, kailangan mo talagang i-prepare siya ng maayos. I-prepare mo siya ng mabuti. Okay? Kasi syempre, compared to adults, mas naiintindihan nating mabuti kung para saan yung procedure na yun at bakit mag-undergo tayo ng ganong procedure. But for infants, okay, mahirap talaga silang i-convince, okay, na mag-undergo ng ganong procedure. Especially if they will be separated from their parents. Diba? Pag kunwari, papasok mo na siya sa operating room at maiiwan na yung parents nila sa labas. Okay? Siyempre, there is feeling of anxiety, there is feeling of separation. So, kailangan natin silang i-prepare ng mabuti. And of course, hindi lang sila. We also have to prepare the parents properly and orient them what will happen, okay, prior, during, and after the procedure. Okay? Support also parents if surgery is to be performed. Okay? Post-op, during the post-op period, avoid disturbing the tension mechanism, okay, which will be in place for about 1 week. So, what are we talking about here, guys? Pag sinabi nating tension mechanism, since nagkaroon tayo ng operation, incision, okay, in the inguinal area, sabihin na lang natin sa may inguinal area, okay, para magkaroon ng descent of the testis in the scrotum. Anong ibig sabihin pag sinabi nating avoid disturbing the tension mechanism? Which is very important, of course, for patients who undergone orchipexy, secondary to undescended testis. Miss Tambo, ano kaya yung ibig sabihin ng avoid during the post-op period, avoid disturbing the tension mechanism? What do we mean by this? Magbigay ka nga ng example.
Iwasan na ma-force yung galaw ng patient.
Okay? Avoid forceful, excuse me guys. Avoid forceful activities that will cause opening of the surgical incision. Okay? Pwede din. What else? Ano yung mga kailangan nating i-avoid na mga activities? You remember guys, 1-year-old ito. Sabihin na lang natin na, kasi di ba yung orchipexy procedure should be done between 1 to 3 years old. So, ibig sabihin na lang natin 3 years old yung patient natin. So, toddler na yung patient natin. So, ano yung mga importanteng activities na kailangan na iwasan ng bata? Okay? After the procedure. Kasi syempre yung mga yan, malilikot yung mga yan very active yung mga yan. So, kindly give a specific. Okay? Sabi ni Miss Tambo, avoid yung mga strenuous activities. Okay? That can actually cause yung removal of the stitches dun sa incision area. Okay? Aside from that, kindly give specific activities that should be avoided by these children who had undergone orchipexy. Okay, Miss Scott. Specific activities, ha?
Ma'am, I think pa is yung, like, ma'am since 3 years old, Like yung catching a ball, ganun ma'am, or yung nagka-climb sila ma'am.
Okay, catching a ball. Bakit pag nag-catch ka pa ng ball,
Ma'am, since it, ano po,
ah,
ma'am, since it, ano po, includes running. So, syempre po,
okay.
ano po yung stress dun sa incision part.
Okay. So, tama. Kasi iniisip ko lang is yung you will just catch. Ang nasa isip din pala ni Mrs. Cat is mag-run pa siya before he catches the ball. Okay, so pwede din yon. Okay, avoid. Kasi di ba ang iniiwasan natin is we are avoiding too much stress, okay, on the incision site that can actually open, okay, the incision. Siyempre, yung incision is hindi lang nasa labas, kundi nasa loob yan. Kasi they are going to tie, syempre, or itatay nila yung part kung saan nagkaroon ng weakened abdominal muscle para hindi bumalik okay, yung testis papasok, di ba? Okay. So, yon. Aside from that, okay, running, catching a ball, ano pa? Okay, last two, Ms. Sarmiento. Ano pa kaya yung mga activities na hindi pwede para sa kanila? Just to give time for the wound to heal, okay? For the incision to heal. Ms. Sarmiento?
Ma'am, kwan po. Ma'am, avoid heavy activities. Ganun po.
Okay, ano nga yung mga heavy activities? Kasi yung heavy, in general, sinabi na kanina ni Miss Kwan yan ni Miss Tambo yun. So, ano yung mga general? Kaya ang tinatanong ko naman ngayon, what are the specific activities?
Ma'am, yung pagkwan.
Kasi syempre, if you're going to do the health teaching, you have to be very specific, di ba? Para nasasabi natin sa kanila kung ano talaga yung mga specific activities that should be avoided, okay, by these toddlers. Okay, come on, Miss Sarmiento.
Ma'am, yung pagtalon ng tumatalon-talon gano'n.
Okay, pwede. So, bawal munang tumalon, bawal muna, basta any activities that can actually cause too much pressure, okay, on the incision site. Aside from that, dapat i-avoid din ang biking, avoid din ang yung mga tight-fitting jeans as much as possible. Kailangan maluluwang yung mga shorts ng bata, okay, para hindi natin naiipit, para hindi ka nagpo-cause ng pain in the incision site. So, there are still a lot of activities that should be avoided. So, alam naman na natin yun. Anything that will cause too much pressure or puts too much pressure on the incision site and anything that can cause additional trauma, okay, to the area kung saan nagkaroon ng surgical operation, those should be avoided. And of course, napaka-importante, sa lahat naman ng mga, di ba, ng mga post-op patients, ang goal talaga natin is to prevent infection. So, we have to make sure na hindi mai-infect yung sugat ng bata. Okay, so avoid contamination of incision. Wound care should also be done. Depende kung anong gusto ng mga doktor. Kasi may mga ibang mga doctors na hindi nila ina-advise usually yung daily na cleaning of wound. I'll just give you an example. Okay, kasi syempre, you will question me pag sinabi ko na hindi daily. Kasi sa mga CS patients natin in the ward, okay, hindi talaga sila daily na nag-dress ng nag-wound care unless yung incision talaga ay merong bloody yung kanyang dressing or talaga makikita mo na meron ng infection. Okay? Sa kanila kasi usually, kunwari na CS yung nanay ngayon, they will actually change the dressing after 2 days, parang ganon. When we had our last duty in the OB ward, so that was actually 3 years ago na kasi. Pero I'm not sure if they are still doing that protocol. Okay? So, hopefully, pag nag-duty na kayo by next semester, ay third year na pala kayo by that time. Pero syempre, you will still have your duty at the OB ward. Okay? Para naman makita ninyo kung ano yung mga activities na ginagawa sa mga OB and pedia patients. Okay? Pero syempre, sabi ko nga kanina dito, pag alam naman na natin, since sa inguinal area to, di ba, sa may perineal area, okay, I think it's just proper that we have to do it as needed. Okay? As needed. Okay? Kasi syempre, doon sa incision site, andyan yung penis. Okay, what if palaging naka-diaper pa yung bata and then palaging nababasa? So as the nurse on duty or as the health or caregiver of that patient, kailangan nating i-assess ng mabuti when to perform wound care or changing of diapers for that matter para maiwasan natin yung contamination of the incision, okay, to prevent infection. Okay? So, next is your hypospadias. Okay. So, guys, di ba notice nyo, ang sa may preschooler, karamihan sa mga lalaki, diba? Parang most of the discussions ay sa mga lalaki naman siya. Okay. So, pag sinabi nating hypospadias, I hope na-imagine nyo itong picture na ito. So, wait lang. Ito lang kasi nakuha kong picture. Okay? So, pag normally, di ba, sa mga lalaki, ang urethral opening should be assessed at the middle. Okay? Dito dapat siya sa gitna. Okay? Pero, pag merong hypospadias or merong ganitong medical condition yung client natin, okay, makikita mo na yung urethral opening ay hindi matatagpuan dun sa may, ano bang tawag natin dito, guys? Sa may ulo na, itong ulo na to, part ng penis na ito. Miss Sarandi. Anong tawag natin dito? Teng. This is the tuli na to, tuli na to. Hindi to uncircumcised. Tuli na siya. Kaya naka-flex. Naka-flex. Nakikita na natin itong part na to ng penis. Ano to? Anong tawag natin dito? Miss Randy. Mag-reset kayo agad, guys. Tatlo masapat tayo ng malpas. Kailangan nating tapusin ito and then we have to start with the third PowerPoint on the common problems among preschoolers. Guys. Miss Randy. Are you still there, Chelsea? Nag-leave na ata si Chelsea, Miss Randy? Miss Ragwal? Miss Ragwal? Anong tawag natin sa part ng penis na to? This is sure? May kausap pa ba ako, guys? May kausap pa ba ako? Wala na.
Shock ma.
Okay, who's there? Sorry ha, pakilakasan.
Stance po. I think it's
Stance ba
the shock.
to?
Yes, ma'am.
Okay. So, tama ba? Shaft daw, sabi ni Stance. Meron pa bang ibang tawag sa part na to ng penis?
Glans penis po, ma'am.
Okay, so the glans. Okay, the glans. Okay, yung covering nito, that is your prepuce. Especially pag kunwari, uncircumcised pa siya, di ba? Yung prepuce, nakokoveran pa niya itong part na to. So if you're going to retract the prepuce, okay, magpapakita yung urethral opening or yung butas dito. And if you're going to check that, dapat yung urethral opening should be located in the center, okay, of the glans penis. Okay? Hindi dapat nandito sa may ventral part, hindi din dapat nandun sa may dorsum. Okay? Pero with this condition, Okay, the urethral opening is located anywhere along the ventral surface of the penis. So pag sinabi nating ventral surface of the penis, sa may babang part. Okay, I hope na i-imagine nyo guys, nasa babang part siya. So ito yung sa may ventral, ito naman sa may, ito yung ventral part guys, o yung sa baba. Ay, sorry, wait lang nga. Okay, so ito naman sa may dorsum, sa may taas. Okay, so with hypospadias, nasa ventral surface of the penis. Okay, yung urethral opening. So you just imagine kung ang bata iihi, okay, na meron ganito siyang condition, imbes na pa-projectile yung ganyang, yung labas ng ihi niya, di ba? Entang mo dito pa ganun, paloob. So, there is a possibility na mabasa yung, going to the pants or mababasa yung pants niya kasi nga hindi talaga pa projectile na ganun dahil nga yung urethral opening ay matatagpuan dun sa ventral portion of the penis. Okay, I hope guys na-i-imagine nyo. Basta dito sa baba. Okay? Kunwari, imagine na lang yung kamay nyo. Kunwari, yung kamay sa mga babae, yung kamay, straighten nyo yan. Okay, pag sinabi nating ventral portion, sa may baba ng nails. Okay, dito sa part na to, nasa may baba. Okay, yung urethral opening, hindi nandun sa may gitna. Okay, so that is for hypospadias. Okay, ang 4D naman is the ventral curvature of the penis, which is often associated with this condition causing constriction. Okay? Diba? Usually, paano ko ba i-describe to? Okay. Pag ang penis ay hindi pa siya erected, okay, walang excitement, diba? Siyempre, nakababa pa lang siya. Okay? So, you actually observe 4D pag kunwari nagkaroon ng erection because of sexual excitement, makikita mo na nagkakaroon siya ng curvature or hindi siya erected upward, kundi ano mo dito? Yung sa may glans na ay towards, hindi siya towards the abdomen, kundi towards. Pag ganun, paano ba i-determine yun? Wait lang guys. Hindi siya pataas. Nagkakaroon siya ng ventral curvature of the penis. So, I hope na na-imagine nyo yung erected penis, guys. Okay? Pag naka-erect, di ba, towards dapat pataas. Pero with 4D, pabangking siya. Hindi siya pataas, kundi yung upper part, okay, doon sa may glans ay nagkakaroon ng curvature doon. Okay? So, in extreme cases lang naman, hindi naman sinabi dito na 50%, ganyan-ganyan, the child sex may be uncertain. Okay? Especially, pag kunwari, di ba meron tayong tinatawag na hermaphroditism or yung tinatawag natin na hermaphrodites. Pag sinabi natin hermaphrodites, ano nga ba ibig sabihin pag hermaphrodites, Miss Ragwal? Ano ang hermaphrodites? How do we define hermaphrodites? Remember that the sex, okay, or the gender of the conceptus is already known by the time na nagkaroon ng conception. Kasi malalaman mo na doon if that is XY or XX. Okay? And then, yung sa identification ng gender ng bata, okay, ay usually nare-reveal lang yan through ultrasound. Pero dito kasi with the hypospadias, may mga sabi nga dito, in extreme cases, may mga times na the child's sex may be uncertain. So, they're not sure if the child is male or female. Okay? So, that is what we call, no, sorry. Going back to my question, Miss Ragwal, ano ang term na, ano ang term sa, ano ang definition ng hermaphrodite? Miss Ragwal? Oh, how about Miss Pascual? Miss Pascual, anong ibig sabihin pag hermaphrodite? Kasi there are also times na ganito eh. They are considering na yung batang ito ay may ganitong condition. Since they are uncertain of his or her gender. May kausap pa ba ako? Wala na po.
Ma'am,
Miss Pascual? Yes, Miss Pascual?
Yes po, ma'am.
Narinig mo ba yung question ko?
Yes po, ma'am.
Oh. So come on, define what is an hermaphrodite.
Ma'am, it is parang kwan po siya, disorder po sa sex development po ng patient.
Wherein?
Parang it is between the external and internal sexual and genital organs po.
Okay. Yes, pero pag sinabi natin hermaphrodite, anong ibig sabihin nun? That person is having
Two reproductive organs, ma'am.
okay, very good. Two reproductive organs. Pero in this case kasi, di ba, in this case naman, ang tawag mo dito, since sabi nga natin kanina dito na this may be associated or in extreme cases, the child's sex may be uncertain. So, they might be considering na this child may have a condition which we call hermaphroditism. Okay? Pero sa case kasi na ito guys is pwedeng siguro meron siyang hindi natuloy na female organs at ang nag-push through ay yung male sex organs, parang ganon. Pero in extreme cases lang naman. Okay? Most of the time, if they're going to undergo comprehensive examination, they will still find out that the sex of the child is still male. Okay? And of course, this condition should be corrected also. Okay? So next is your epispadias. Okay? So this is actually a very rare condition which is often associated with bladder extrophy. Okay? And this one need early referral for parental counseling. Then patients may be totally incontinent. Okay? Pag ang hypospadias, guys, itong condition na to, ang urethral opening ay matatagpuan sa may ventral portion ng penis. Ang epispadias naman ay condition kung saan yung urethral opening ay matatagpuan sa may dorsal portion of the penis or sa may taas. Okay. Sorry, hindi masyadong clear yung picture natin dito. Okay, dito sa pie part na to. Okay, and based on observations and assessments, sabi nga dito, patients may be totally incontinent. Okay, so yun ang medyo mahirap pag may ganitong condition. Kaya nga, they really have to have, or you really have to refer, okay, the parents for parental counseling para malaman nila what should be the next step to be done to correct the condition. Okay? Ulitin natin guys, pag hypospadias, the urethral opening is located in the ventral or dorsal part of the penis. Hypo.
Ventral.
Okay. How about for epiphagus?
Sa dorsal, ma'am.
Okay, dorsal part. Naku, isa lang ata yung estudyante ko ngayon, ah. Okay? So, for the medical management, sabi dito, there is minimal defects. Okay? This needs no intervention. Pero, kung ang problem naman natin dito ay yung total incontinence ng bata, okay, this needs immediate intervention. Pero kung ang case ng bata naman ay hindi nagkakaroon siya ng total incontinence, okay, the medical management siguro is not necessary. Okay, pero yun nga sabi ko kanina, if it causes total incontinence, the child needs to undergo a correction of this condition. Okay, neonatal circumcision is usually delayed and tissue may be needed for corrective repair. Okay, surgery performed at 3 to 9 months, 3 to 9 months old, 2 years of age for complex repairs. Kasi may mga times, guys, na hindi lang siya once na ginagawa. Okay? Especially sa mga cases kung saan talagang medyo complicated yung case ng epiphagus, hindi lang siya once na ginagawa. Hindi lang once na ginagawa yung procedure. It will take siguro mga 1 or 2 sessions before you will totally correct the condition. Okay, for complex cases. Okay, so for the assessment findings, which we already discussed a while ago, so the urinary meatus is misplaced, and you can actually find that in the urethral opening is usually found in the dorsal part of the penis. So there's also inability to make a straight stream of urine. Okay? Kung kanina sa epiphagus pababa yung stream of urine mo, sa epiphagus naman pwedeng pataas or totally talaga hindi ka makakapag-create ng straight stream of urine when the child will urinate or is urinating. For the nursing interventions, okay, syempre, especially sa mga bata, di ba? Nowadays, we always put, di ba, diapers. Hindi na gaya ng dati na yung cloth ang ginagamit natin. Ngayon, we always use diapers. So, ganun pa din. You have to diaper the baby normally. You have to put the diaper normally. Provide support for, especially kasi di ba, they are experiencing, for complex cases, total incontinence. So, kailangan natin silang lagyan ng diaper. Okay, and then provide support for parents regarding the condition. Okay, provide support for child at time of surgery. And post-operatively, you have to check pressure dressing, monitor catheter drainage, and assess pain. Okay, so dun muna tayo sa post-operative na consideration. Check pressure dressing. So as I have said a while ago, okay, yung change of dressing will be as needed or PRN depending on your assessment as the nurse. If you think na kailangan na natin palitan yung dressing kasi sobrang soaked na siya with blood, okay, or secretions, you may do so. Okay, pero syempre you have to talk to the physician muna kasi baka mamaya may protocol sila na yung dressing should be changed after 24 hours, mga ganyan. Kasi may mga ibang protocol din yung mga ibang surgeons natin. So, kailangan mo din kausapin. Okay? So, always make sure that the dressing is dry para ma-prevent natin yung infection natin. And then, syempre, you have to do strict aseptic technique while performing the procedure to prevent infection. Okay, monitor catheter drainage. Okay, kasi baka mamaya, bloody na yung discharge natin. Okay, that needs immediate referral to the doctor on duty. Okay, and then assess pain. Okay, guys, remember that pain especially yung assessment of pain, especially for children, is usually medyo mahirap gawin. Diba? Pero, meron tayong scale, specific scale na ginagamit, pain assessment scale na ginagamit sa mga bata. Okay, I hope you were able to discuss this in your case protocol. Ano yung pain assessment na model na yon na ginagamit natin sa mga bata? Hindi na? For sure, nadidiscuss nito sa case presentation ninyo. Hindi pwedeng hindi. Kasi ibang assessment natin. Siyempre sa mga adult, since we can actually quantify kung ano yung pain scale natin. Like for example, at the rate of 0 to 10, ate, paki-rate mo nga yung pain mo. Tapos ibibigay mo na yung description for 1, 2, 3, etc. etc. And the client will tell you kung ano yung pain scale niya. Pero sa mga bata kasi, especially sa mga infants, okay, sa mga hindi pa nakakapagsalita, okay, we usually use this pain assessment model, okay, to identify kung ano yung pain scale nila. Okay, what is that specific pain scale model? Assessment model. Anybody from the group? Okay, search. Guys, alam ko na di-discuss nyo to. Miss Obra.
Ma'am, try ko po.
Okay.
Ma'am, yung flux scale po.
Ay guys, sorry ha. Tumatawag si Ma'am Tin. Saglit lang guys ha. Meron pa tayong isa. Aside from the flux scale, meron pa tayong isa. Gusto ko yung answer na yun, yung isang scale natin na ginagamit. Okay, wait lang guys ha. I just need to receive this call. Okay, so going back, sorry guys ha. May concern lang si Ma'am Tin regarding make-up red them. Okay? So, saan na nga tayo ulit? So, sa pain scale. So, tama yung sinabi kanina ni Miss Obra. Isang ginagamit natin na pain assessment scale for children ay okay, so flag scale. So that is just one assessment scale to assess pain for children. Ano pa?
Ma'am, Mayhan po.
Okay, Miss Mihan.
Ma'am, yung Wong Baker faces po.
Okay, very good. Yung Wong Baker, yung nakikita natin yung mga assessment scale for pain yan ha. Wong Baker. Okay? Makikita mo doon yung mga different facial expressions ng mga bata. Hindi ko kasi ma-paste dito guys. Hindi ko alam i-paste yung nakita ko sa internet. Okay? Pero yun is Wong. Pakikuan mo na lang yung spelling niya, Miss Mayhan. As you pronounce pa siya, okay, para maisulat nila. Yung FLAC is F-L-A-C-C. Yung sinabi kanina ni Miss Oprah. F-L-A-C-C. Yung sinabi naman ni Miss Mayhan is yung, ulitin mo nga Miss Mayhan.
Wong Baker faces po.
O, ilagay mo dun sa chat box. Wong Baker assessment scale. Okay. So, yung Wong Baker, yun yung common na ginagamit natin if we are assessing pain, okay, among infants or sa mga young children. Okay, yung facial expression mismo yung chine-check natin if they are having mild, moderate, or severe or intolerable pain. So, kailangan as a nurse, dapat keen observer ka. Alam mo, dapat i-differentiate yung 0 to 2, yung 3 to 4, 5 to 7, 8 to 9, and yung 10 na facial expression para alam mo if your patient is only experiencing mild, moderate, or mild pain or moderate pain, or kailangan na ba talaga niya kailangan ba niya na mabigyan ng mga medications, okay? Especially pag ang patient natin is experiencing intolerable pain. Okay, sa mga matatanda, usually, pag moderate to severe pain, especially pag severe, I should say, ang binibigay natin na medication ay yung mga opioid analgesic. Okay? Especially sa mga patient na may malignancy or may mga cancers, usually yun ang drug of choice natin, yung mga opioid analgesics. Okay? For severe, okay, to intolerable pains. Okay? So, ulitin natin, FLAC scale and yung Wong Baker scale, ang common na ginagamit natin. Okay, next is enuresis. Okay, so enuresis, the involuntary passage of urine after the age of control is expected. Okay, and that age is about 4 years of age. Okay, I hope na wala sa inyo dito ang nagkaroon ng ganitong condition when you were 4 years old. Okay, pero sometimes kasi 'di ba, may mga bata talaga na pag kunwari masyadong napagod maghapon na maglaro, may mga times talaga na they usually experience incontinence. Okay? Especially at night. Okay? Pero itong condition naman kasi na ito is talagang frequent na siya. Okay? And we have types of enuresis, I should say. Okay, number 1 is primary. So, pag sinabi nating primary enuresis, okay, so this is, the enuresis is considered primary in children who have never achieved a control or urinary control. Yung every time na lang is nababasa yung pants nila or yung shorts nila dahil nga wala silang bladder control na matatawag. Okay, pag secondary enuresis naman, this is common in children who have developed complete control, okay, when they were, kunwari sabihin na lang natin, 4 years old, 5 years old, 6 years old, and then suddenly loses the ability to control urination because of underlying medical conditions. Like for example, nagkaroon siya ng bladder injury, okay, that causes yung enuresis. Okay, ulitin ko, pag primary, it is primary, pag yung bata have never achieved control. Secondary naman, kung dati nakokontrol naman niya, and then suddenly, he loses his or her ability to control, okay, his or her urination. Okay? So this may occur at any time of the day, but is most frequent at night. Okay? Very frequent at night siya. And then this is more common in boys. Okay, among boys, there is no organic cause. No organic cause can be identified. So, which means na it may be idiopathic in nature. Okay, and it also may be due to familial tendency. Okay, so kunwari, tanungin mo yung nanay mo, noon bata ka ba, meron ka bang ganitong condition? Okay? At kung sasabihin niya, oo na, kasi nung grade 5 pa ako, nakakaihi pa rin ako sa higaan ko. Okay? Or nung high school ako, may ganyan pa din akong may instances pa din na nakakaihi ako sa higaan ko, o alam mo na kung kanino ka nagmana. Okay? So, ay yung mga etiologic possibilities, maybe due to sleep disturbances. Okay? Like for example, sa mga merong insomnia, mga ganyan, merong mga anxiety disorders that they can't really have a good sleep, so it may be associated with that. Delayed neurologic development, okay, siyempre this is also associated with your ability to control your bladder, okay, or yung urination mo. Immature development of bladder leading to decreased capacity. Okay? Hindi mo talaga nasisense kung kailangan mo na bang umihi, yung bigla-bigla na lang lalabas yung ihi mo, parang ganon. And psychologic problems. Okay? Kaya napaka-importante din guys yung mental health because this may be associated to this condition. Okay. Yan, like for example, pero di ba may mga ganong conditions, may mga ganong situations when we were in, sabihin na natin na preschool or elementary days. Di ba meron tayong mga unforgettable classmates na nakakaihi sa klase, nakakatai sa klase, okay, because of too much stress and anxiety. Okay, kaya napaka-importante na ang mga bata, okay, when they go to school, kailangan i-orient mo sila ng todo-todo. Kung ano dapat yung mga expectations, what are the things that they need to do inside the classroom. Hindi yung every time na papasok yung bata, I should say, ay laging stress yung nasa utak niya. Kasi pag mataas ang anxiety level, okay, there is a possibility na pwede magkaroon ng urinary incontinence. Okay? Or fecal incontinence. Yan. Okay, I hope na wala kayong mga ganyan naging classmates dati. Kasi di ba, pag may mga ganyan, hanggang ngayon, na re-retain sa utak natin na, si ganito, nung elementary kami or nung kinder kami, nakataiyan sa klase namin or nakaihiyan sa klase namin. Parang mga ganun, di ba? So parang hindi nawawala sa utak ng mga classmates nyo yung ganun na nangyari. Okay? So for the medical management, okay, you have to encourage bladder retention exercises. So, for the bladder retention exercises, okay, sa mga girls, I can actually advise na we can perform mga exercises that strengthens the perineal muscles. Because in a way, if you strengthen the perineal muscles, okay, perineal floor muscles, na-strengthen na din natin or na-improve na din natin yung bladder control. Okay? Yung Kegels exercise is one. Diba? kahit sa mga lalaki, pwedeng-pwede nila itong gawin. Kahit nasaan tayo, kahit anong ginagawa natin, you can actually perform this exercise. Okay, guys, do you know how to perform Kegels exercise? Miss Obenario, if you're going to teach your patient how to perform Kegels exercise, ano ang sasabihin mo sa kanya? Miss Obenario.
Ma'am, i-empty po yung bladder, then sit or lie down.
Tapos?
Tapos, tighten the pelvic floor muscles po. Then, hold it and count to 3 to 5 seconds. Then,
Okay.
relax the muscles po.
Okay. Kung Ilocano ka ba, Neng?
Ma'am, hindi po.
Tagalog. Kung kunwari sabihin na natin, hindi naman Inglesero yung patient mo. So, alam ka naman na, okay, you have to go to the bathroom na. Okay, kung hindi na naiintindihan yung ganon, okay, in layman's term, yung naiintindihan ng kahit na sino, regardless of educational attainment, paano mo i-explain yung Kegels exercise sa kanila? Sige na.
Una po is umihi po tayo, tapos pagkatapos po nating umihi is maupo po tayo or mahiga, and i-tighten po natin yung pelvic sa pag-upo po, tapos mag-count lang po tayo ng 3 segundo hanggang 5 segundo, and pagkatapos po is i-relax po natin yung mga muscle natin.
Anong muscle, sabi ng patient mo, anong muscle yun? Sabi na, dami nating muscle sa katawan.
Yung pelvic muscle po.
Hindi niya alam ang pelvic muscles. Anong sasabihin mo? Necessary ba na kailangan nakahiga? Kasi while I was searching din kasi kagabi yung bladder retention exercise na yan, most of the pictures that na I saw were yung parang nag-exercise ka talaga ngay na nakahiga ka, and then what they usually do is yung parang yung ano nga sinabi ko dati na kuha natin, exercise sa mga buntes, yung parang mag-8-8 ka, pero yung sa may lower back lang yung tumataas, parang ganon. That is for the bladder retention exercise. So, pero in general, I'm asking of yung Kegels exercise. There is a simpler way to explain to your patients how to perform Kegels exercise. Okay, so okay din yung sinabi ni Miss Obenario, pero I want a simpler way for you to explain Kegels exercise to your patient. Miss Miranda. Give it a try, Miss Miranda. Miss Miranda.
Wow. Wait,
O, diba kahit ngayon, kahit nagre-recite ka, pwede mong gawin yung Kegels exercise. O, in the simplest possible way, how are you going to explain this to your patient?
Siguro
Kahit Ilocano, Tagalog. O, sige, okay lang.
hindi ko alam.
Hala, Diyos ko. Tawag mo dito, gasgas na yung Kegels exercise sa mga case presentation, sa lecture. Alam mo yan. Nahiya ka lang sigurong sabihin or nahiya ka lang sabihin kung ano yung nasa utak mo. Sige, Ilocano, Tagalog, pwede. Huwag lang English. Kasi siyempre, pag nasa clinical area kayo, usually ang gagamitin nyo will be Ilocano and Tagalog. Miss Miranda. May Ilocano, sige. Mas gusto kong marinig how you're going to explain that to your patient. Guys, 9:00 na naman. Nandito pa lang tayo akala ko matatapos tayo dito.
Ma'am, ako na lang po.
Sino to, Miss?
Ma'am, Miss Javier po.
Miss Javier. Sige, laktawan na natin yung iba. Punta muna tayo kay Miss Javier.
Ma'am, one good example po ng Kegel's exercise po is yung kapag umiihi po is i-try pong i-contract or pigilan po yung pag-ihi.
Okay? Sige, explain mo na mabuti na yung pigilan and then pipigilan mo forever, garod, ganon.
Ma'am, pigilan lang po, i-hold po for mga about
Hold.
5 seconds, I think
And
po.
then,
Then, i-release po. Tapos, i-repeat lang po siya for at least 3 to 5 times.
okay. Kahit hindi naman siya 3 to 5 times as long as you want, you can actually perform Kegel's exercise. Kahit nga maghapon, pwede mong gawin yung Kegel's exercise, di ba? Kung yun ang gusto mo. Okay, so yun yung pinaka-simplest way to explain. Yung parang, ate, pag kunwari, di ba, pag ihi ka, okay, i-try mo na i-stop yung pag-ihi, and then, ihi ulit, stop, ihi, stop, ihi. Okay? As long as you want to perform that procedure. Kasi, habang ginagawa mo ito, it actually strengthens the pelvic muscles, okay, and in a way, it also improves your bladder control. Okay? So, behavior modification is also one medical management. Like for example, okay, nakalagay dito na example natin, bed alarm devices. Okay, like for example, sa gabi, pag natutulog ka sa gabi, mag-alarm, kunwari maaga ka natutulog ka ng alas 8, mag-alarm ka ng 12. And then, kung every 4 hours kang umiihi, kasi alam mo naman, di ba, kung ano usually yung time mo, okay, 12, and then mag-alarm ka ulit ng mga 4 or 5. Para, yung sa body clock mo, di ba, okay, masana yung katawan mo na at these specific hours, kailangan mong gumising, okay, to urinate, para hindi nagkakaroon ng incontinence. Okay? For the drug therapy or medications that are usually given, remember guys that if you are taking medications, okay, usually kasi if you're going to check the medications that are given to patients na nagkakaroon ng ganitong medical condition, most of the time, these medications are associated with associated with sa mental disorders. Diba? Like for example, tricyclic antidepressants, yung most common dyan is yung imipramine, hydrochloride, or yung tinatawag natin na tofranil. Okay? And of course, anticholinergics. Examples will be anti-anxiety, antidepressants, mga ganyan. So, wag kang mas lalong ma-depress mo, ala, bakit ganito naman na ang binibigay sa akin? Nababagtip ko, parang mga ganon. Di ba? Usually yung ganon yung pumapasok sa utak natin. Pag nagbibigay yung doktor natin ng mga ganitong medications, na alam mo na ito ay para sa mga patient na may mental illness, parang ganon. Pero, ito talaga yung binibigay nila to treat the condition. Kasi, remember, dun sa previous na slide natin, ang isang cause will be we go back to this one. Okay? Yung etiologic possibility, psychologic problems. Okay? Yan. Pero syempre, if your patient is taking this medication, guys, this is not an over-the-counter medication. It should be prescribed by a physician. Okay? Kasi syempre, ang mga ito ay talagang binibigay lang sa patient na kailangang mag-take. Okay? Because of its side effects. May mga unpleasant or even dangerous side effects yung mga medications na ito na kailangan ay from time to time ay chine-check ng prescribing doctor or even the nurse. Okay? So, ano yung mga assessment findings? Pag may enuresis, okay, the physical exam may be normal. So, makikita mo, normal lahat yung mga physical exam results. Okay, pero, pag mag-history taking ka na, okay, the patient will definitely tell you na there is history of repeated involuntary urination, which usually occurs at night. Yan. Diba? Okay, for the nursing intervention, provide information or counseling to family as needed. Okay, kasi syempre, baka mamaya kasi, ang mga nanay kasi kung minsan, di ba, may mga times na nag-exaggerate kami. Like for example, iniisip namin na parang ito lang niya is a way para ano tawag mo dito, hindi mapagalitan kung may mga hindi ginawa, mga ganyan, may mga alibay lang niya yung condition niya na ito. Pero we have to do a thorough we have to provide information and counseling to family as needed. Meron talagang ganitong condition, okay? At baka yung anak niya ay isa sa mga bata na merong ganitong condition, which is enuresis. Okay? We have to confirm that it is not conscious behavior and that the child is not purposely misbehaving. Kasi baka mamaya iniisip ng mga nanay nga na parang pinapahiya siya in front of the madla or madlang people, na every time na lang na nasa party sila, naiihi siya, mga ganyan. Okay, so ini-interpret nila doon as parang nagiging pasaway siya or the child is misbehaving, when in fact, talagang meron talaga siyang ganung medical condition. Okay, kasi kawawa naman ba, guys, yung bata, kung nagja-judge na tayo na he or she is just misbehaving or consciously na ginagawa niya ito para lang mapahiya yung mga nanay or tatay niya, mga ganyan. So, kailangan natin silang i-inform, okay, that there really is a condition such as this. Okay, assure parents that they are not responsible and that this is a relatively common problem. Okay? Pero kailangan syempre talaga natin ng management for this. Okay? So long as talagang nagsisik sila ng medical advice, okay, sa mga doctors concerned. Okay? Involve child in care, give praise and support with small accomplishments. Okay? Like for example, within age 5 to 6 years old, syempre pag sinabi natin age 5 to 6 years old, medyo malaki naman na yung bata pag 5 to 6 years old, di ba? Okay, so sabi dito, give praise and support with small accomplishments. So kung kunwari, nakaihi nga siya, pero yung bata naman can actually strip bed of wet sheets on his own or on her own, and then nilalagay niya sa laundry bag. So, sa mga simple na accomplishments lang naman na ganito, okay, yung mga initiative nila na ganito, you have to praise them. Okay? Para hindi na lang puro galit yung lumalabas sa bunganga ng nanay or ng tatay. Ha? Kasi in that way, parang nalilesen din yung feeling of anxiety and stress, because that can actually add up to yung pagkakaroon nila ng urinary incontinence. Diba? Nakaihi na nga siya, pinagalitan mo pa. Or the more na hindi talaga niya makakorek yung condition na yon, diba? Mas lalong tataas yung stress level, anxiety level ng bata. Okay? Age 10 to 12 years old, okay, pag kunwari, can do laundry and change bed on his own or on her own. So you have to praise them. Yan. Avoid scolding and belittling the child. So this is very true. Pero sometimes kasi, di ba, alam niyo na mga nanay, nakagaya ko, okay, honestly speaking, may time din talaga na nagiging nagger ako, na kunting kamali lang din, ay nagagalit ako. Okay? Kaya din yun din talaga yung iniiwasan ko sometimes. Pero kung most of the time, ko ba, madali akong mairita, guys. Kaya ako minsan napapagalitan din ako ng asawa ko. Sabi niya, no estudyante, nagsingkit ka. Pero no anak mo, basit lang mabanag, pinapagalitan ko daw sila. Which is, sometimes nagre-reflect ako kasi totoo naman. Okay? Totoo din naman. siguro is, as a mother, kailangan talaga din na ma-explain sa kanila na pag may ganitong condition yung anak is you have to give yung proper orientation, or you have to educate the parents na yun nga, hindi ito misbehaving. Okay? At talagang mayroong ganitong condition. Okay? Next is Wilms tumor. Okay? Wilms tumor, or what we call nephroblastoma. Okay? Guys, palagi itong lumalabas sa mga board examination or examinations, itong Wilms tumor na ito, because this is also common among preschoolers. Okay? Pag sinabi nating Wilms tumor, there is large, and parang nakikita natin dito, yan. Okay? This is a large encapsulated malignant tumor that develops in the renal parenchyma, more frequently at the upper pole of the kidney, usually, and this one is usually unilateral. Okay, I repeat. Okay, malignant tumor po siya, kaya kailangan ng proper intervention, or kailangan ma-diagnose ito the soonest possible time para mabigyan ng proper medical and surgical intervention. This one usually originates during fetal life from undifferentiated embryonic tissues. Okay? So kung walang proper differentiation, okay, nagkakaroon tayo ngayon ng formation of cancer cells in the renal parenchyma. The peak age of occurrence is usually at 3 to 4 years, or even 6 months to 5 years old. Okay? So this is associated with congenital anomalies. So pag kunwari na-diagnose yung bata na may ganitong condition, Wilms tumor, this can be associated with aniridia or lack of color in the iris. Okay, like yung nakalagay dito. Okay, lack of color in the iris. Cryptorchidism or undescended testis, hypospadias, and pseudohermaphroditism. Okay, so ito yung mga associated conditions pag ang patient natin is also diagnosed with Wilms tumor. Kaya kailangan nila mag-undergo ng comprehensive physical examination. Okay, para ma-determine nila na aside from the Wilms tumor, meron pa ba siyang associated conditions such as what I have mentioned a while ago. Okay, kasi baka mamaya may Wilms tumor siya, tapos meron pa siyang cryptorchidism, or meron pa siyang pseudohermaphroditism, mga ganyan. Hindi lang Wilms tumor lang pala yung problema ng bata. Okay? Prognosis is good if there are no metastasis. Pag sinabi nating metastasis, okay guys, anong ibig sabihin pag metastasis? Ito kasi ang kalaban natin pag cancer cells eh. Once it is already metastasized, magdedepende yung prognosis natin doon. Okay guys, what is metastasis? Metastasis is talaga, ito na Miss Mendoza. Ito talaga tatawagin ko.
It is the spread of cancer cells from the place where they first formed to another part of the body.
Okay. Okay, pakiulit, Miss Mendoza. Mas malakas, Neng. Lakasan mo.
It is the spread of cancer cells from the place where they first formed to another part of the body.
Okay, that's metastasis. Very good. Metastasis is the spread of cancer cells from the organ of origin to other parts of the body. Okay, kaya nga may mga ibang condition guys na kunwari, ang sakit niya is breast cancer. Pero, it has already metastasized to the bone. Yung cancer cells ay nag-metastasize na sa bone, sa liver, sa other reproductive organs, and then sa brain. May mga ganong conditions talaga. Okay? And most of the time, pag nagkaroon na ng metastasis, nasa late stage na usually yung cancer. Okay? Kaya napaka-importante na kailangan we have to be very conscious kung ano yung mga nararamdaman natin, and dapat alam din natin kung ano yung mga signs, okay, and symptoms of cancer. Okay? Do you guys remember yung potion as? Yun kasi yung ano tawag mo dito? Mnemonics na ginagamit natin. Okay? Yung potion as, okay, para sa mga signs of cancer. Okay, yung C, hindi ko masyado memorize ito, pero yung mga nare-remember ko lang ha. C is change in bowel movements. Okay, example, kung dati regular ka naman na nagde-defecate, and then suddenly, once a week ka na lang nagde-defecate, and then nagkakaroon ka pa ng, ngayong week na to, diarrhea, and then next week, there is constipation, mga ganyan. So, that could be one sign of malignancy, or to, yung cancer na developing inside of you. Okay? U, sorry guys, hindi ko matandaan lahat. U is unexplained anemia. Kung dati naman yung hemoglobin level mo is normal, and then suddenly, bigla ka nagkaroon ng anemia. Okay? Kasi yung mga cancer cells, sila na yung ang tawag mo dito, nagtitake ng mga nutrition or nutrients na kinakain ng patient natin. Kaya most of the time, nakikita nyo guys, diba, pag nasa late stage na, sobrang payat ng mga patient natin na may malignancies. Okay? Thickening or lump in any part of the body. Yung T, thickening or lump in any part of the body. Okay, like for example, siguro sa breast, basta sa kahit na anong part ng katawan na nagkakaroon tayo ng mga lumps. Okay, or thickening. Okay, that could be one sign. Okay, indigestion, I. Okay, yung A pala guys is a sore that does not heal. Kung kunwari, dati may sugat ka, tapos hindi naman na siya nag-heal. 1 month na, hindi na nag-heal. Okay? Okay, and is nagging cough. Actually, meron ito sa ninyo, sa CHN book. Pero I think hindi natin na-discuss ito nung CHN natin. Nagging cough or hoarseness. Hindi ka nawawalan ng ubo. Okay? Unexplained weight loss, yung U. O, bahala na kayo guys na mag-take note dito. Unexplained weight loss. Baka mamaya ibigay ko to sa quiz bukas. Unexplained weight loss. O, bigla na lang, dati 70 or 80 kilos ka, tapos in just 2 weeks, naging 50 kilos ka. Okay, so that's already unexplained weight loss. And, sudden change in the color of warts, parang ganyan. Okay? Yung iba yung, di ba usually ang mga warts to, no, sorry, moles pala. Sorry, warts, moles. Okay? Di ba dati, di ba guys, ang color ng mole should be black, di ba? Pero may mga times na nag-iiba-iba yung color, nagiging red or nagiging purple, mga ganyan. So, pag nakikita niyo nagkakaroon ng change in the color of yung mga moles, that would be one sign ng malignancy. Okay, yung O, sorry, nakalimutan ko yung O. Mamaya, isipin ko ulit. Okay, so those are the signs of cancer that we have to be aware of. Okay, caution us ang kwan nun, guys. Basta i-memorize nyo yung first letters. Change in bowel movement, a sore that does not heal, unexplained anemia, thickening or lump in any part of the body, indigestion, hindi ko matandaan, sorry. And then, nagging cough or hoarseness, U, unexplained weight loss, and S, sudden change in the color or size, color and size of moles. Ganyan. Okay? Okay. So, sabi nga natin kanina, prognosis is good if there are no metastasis and if you have detected the cancer at an early stage. Okay? So for stage 1, sa metastasis tayo ha, stage 1, limited to the kidney lang, yung cancer cells. Pag stage 2, the tumor extends beyond the kidney but is completely encapsulated. Stage 3, the tumor is confined to the abdomen. Okay, stage 4, tumor has metastasized to lung, liver, bone, or brain. Okay, and then stage 5, bilateral renal involvement at diagnosis. Okay, so guys, napaka-importante na pag meron tayong family history of malignancies, we really have to be very cautious. Okay? Kung kailangan natin ng yearly na checking, general check-up, we have to do it. Para makita natin, prevent natin yung late diagnosis. Okay? Yan. Okay, kasi meron akong kilala na nurse sa VRH. Okay? Meron akong kilalang nurse sa VRH na meron, kasi di ba sa mga babae, very common, one of the top 10 leading cause of mortality among women is breast cancer nowadays, di ba? So, meron OB ward siya. Okay. Dalawa na yung kilala kong taga-VRH na nasa OB ward na namatay dahil sa breast cancer. I don't know what is present at the OB ward na doon talaga yung highest incidence rate ng mga nurses na nagkakaroon ng nurses and doctors na may nadadiagnose with breast cancer. Okay? Ang nangyari sa kanya, natapilok lang daw siya, no? Natapilok lang daw siya, and then, syempre, kailangan niya magpa-x-ray para for yung kung kailangan bang malagyan ng metal or kailangan ng masimento. And then, nakita nila doon sa x-ray niya na parang may iba. Bakit ganun? Very brittle. Natapilok lang tapos talagang yung kanang fracture is malala. And then, nagsuspect sila na baka there is something wrong. So, nagpa-general check-up siya and then they found out, guys, na yung patient na yon or yung nurse na yon ay naroon na siyang stage 4 breast cancer. And then, only to find out, nag-metastasize na siya sa may brain, sa bones, kaya pala, very brittle na ang kanyang bones dahil nag-metastasize na din sa bone. And then after, parang few months after diagnosis, mga 5 months lang kasi nagpunta pa siya ng St. Luke's para chemotherapy, pero in just parang 3 to 5 months, namatay din yung nurse na yun. Okay? Kaya guys, hi, girls, mga girls dito, okay? Kailangan natin na we have to be very conscious kung ano yung mga nakakapakapa natin, especially pag nag-BSE tayo. Okay? Kasi di ba alam nyo kung paano mag-BSE, so you have to do it. Hindi yung, ayoko mag-BSE kasi baka mamaya may makapa ako. Kaya ngayon ang, di ba, purpose ng BSE, para ma-determine natin kung meron tayong mga unwanted nodules or masses na nakakapa sa breast. Okay? Usually, going back to Wilms tumor. So, when you assess the patient, okay, during physical examination, the mother usually notices mass while bathing or dressing the child. So, yung mass na yun is non-tender, so hindi siya masakit, and usually located at the midline near the liver. Okay, so where is the liver located? Saan ba malolocate ang liver? Miss Mariano. Anong quadrant ng abdomen? O, if you're going to divide the abdominal quadrant into 4, saan mo mapapalpate ang majority of the liver? Saan napapalpate?
Sa upper right, ma'am.
Ma'am, right upper quadrant po.
Okay. So, yan. Dalawa silang nagpon dito. Okay. Stance and Miss Mariano, right upper quadrant. Okay, so kung nakita mo, nakakapa mo habang binibihisan mo yung anak mo or pinapulbuhan mo, may nakapakang bukol. Okay, syempre, di ba, pag mga bukol-bukol na kasi na yan, especially sa mga bata, kailangan mo talagang i-address ng agad-agad para malaman mo kung ano ba yung bukol na yon. Okay? Hypertension and possible hematuria, anemia and signs of metastasis may be present. Okay, basta ulit yung anemia. Okay? So, sa mga bata, syempre, in order for you to check if there is already anemia, the patient should undergo a complete blood count. Okay? Para malaman natin if the hemoglobin level is still within the normal range. Kasi kung masyadong mababa na siya, syempre, ang magiging diagnosis mo na dyan will be anemia. Okay? Remember na meron tayong different types of anemia which will be discussed for the later on pag nandun na tayo sa third na PowerPoint presentation for preschoolers. So, for the diagnostics, paano yung mga laboratory exams? Okay. IVP reveals mass and the CT scan or sa ultrasound. Okay, so pag magpapa-ultrasound yung patient natin, magpapa-CT scan, makikita doon na meron talagang mass in the kidney. Either on the left or on the right. Okay? Kasi usually, di ba, unilateral lang siya. Okay? Nephrectomy or the removal of the kidneys with total removal of tumor or the kidney affected. So, ito usually yung ginagawa nila na surgical intervention to prevent further metastasis of the cancer cells. Okay? Pero sometimes kasi discretion na po yun ng doctor depending on the stage, okay, of cancer. Kung kunwari stage 4 na siya, I think hindi na nila ginagawa yung nephrectomy na ito unless stage 1 pa lang yung diagnosis at confined pa lang talaga sa my kidney. And it is not metastasized to other parts of the body. Okay? So, post-surgical radiation is also encouraged in treatment of stages 2, 3, and 4. Okay, sa stage 1 naman, it does not usually require radiation, but it may be used if the tumor histology is unfavorable. Okay, kung kunwari stage 1 pa lang siya, pero very active yung cancer cells. Kasi di ba sa yung mga pathologists, madedetermine naman nila yan kung active, ganyan. Alam nila yun. Okay? Based dun sa kanilang imaging. Okay? I-encourage nila yung patient na mag-undergo pa din ng radiation. Okay? So, post-surgical chemotherapy, aside from radiation, is also advised or encouraged. Okay? Kasi, siyempre, sa mga patients na may cancer, usually, yun ang mga common treatment na pinagpipilian natin, guys. It's either they undergo radiation, therapy, or chemotherapy. Okay, pag chemotherapy, guys, kasi medication yung i-inject nila sa vein ng patient natin. Okay, pag radiation naman, syempre irradiation lang yung treatment. Okay, kung saan talagang nakafocus siya dun sa site ng cancer, dun sa organ kung saan mayroong cancer cells. Okay? So, the most common medications during chemotherapy sessions are the following: vincristine, daunorubicin, and doxorubicin. So, these are the most common. Okay, anti-neoplastic agent. Pakilagay na lang dyan, guys. Anti-neoplastic medications or agents. Pag sinabi natin anti-neoplastic, okay, syempre, these are anti-cancer cells. It kills the cancer cells. Anti-neoplastic medications or agents. Okay, so another nursing interventions, do not palpate the abdomen to avoid possible dissemination of cancer cells. Kasi di ba may mga iba, guys, na kung may nakapa silang bukol, from time to time, ito hinahawakan nila tapos pinipisil-pisil para malaman kung lumalaki ba siya or hindi. Okay, you have to instruct the client or even the parents or the significant others not to hold it from time to time, or do not palpate, okay, or percuss the mass, okay, to avoid possible dissemination of cancer cells. Handle child carefully when bathing and giving care. Provide care for the client with a nephrectomy or yung nag-undergo ng surgical operation. Usually perform 24 to 48 hours of diagnosis. Okay? Pero syempre, discretion din na maiba yun kung ipapagawa nila agad yung procedure or they still need time. Okay? Para i-prepare yung bata or yung family sa ganong operation. Financially, emotionally, diba? Provide care for the child receiving chemotherapy and radiation therapy. Okay, kasi remember guys, pag sinabi nating chemotherapy and radiation therapy, there are a lot of nursing considerations for that. Okay? I myself, di ba sabi ko nun sa inyo, my mom died due to breast cancer din, and I really saw how yung pain na pinagdaanan niya because of undergoing chemotherapy and radiation therapy. Kasi both, nag-undergo siya ng both. Chemo muna ng 11 sessions dito sa R2TMC, and then nung nag-metastasize na naman dun sa my neck, kasi may mga bukol-bukol na siya ulit after that, in-encourage ni Doc na mag-undergo siya ulit ng radiation therapy at PGH. And I can attest to the yung sufferings na, and then yung pain na pinagdaanan niya because of those interventions. Okay? Right after the chemotherapy, talagang magsusuka sila, hindi sila makakain ng mabuti, ganyan. And then, after the second session, nung pang third session na niya, naglalagas na yung buhok niya, up to the point na talagang bald na siya. Ganyan. Okay? And then yun, sa radiation naman, talaga makikita mo na yung skin niya is very dry and then wrinkled. Parang ganyan. So, we really have to know what are the considerations, okay, once your patient is undergoing chemotherapy and radiation therapy. Okay? Yan. Next, the nurse should assess toileting habits before creating a teaching plan for the school-age child. Oh, sorry guys, bakit napunta tayo sa UTI? Sorry guys ha, na-misplace siguro ito. Okay, pero idagdag ko na din. Importante din ito, di ba? To avoid frequent UTI, you have to instruct the child in proper front-to-back wiping, hand washing, and toilet use every 2 hours. Huwag yung tinitimpe yung, ang tawag mo dito, yung pag-ihi or mamaya na until such time na ang tawag mo dito, punong-puno na yung bladder. Sorry guys, na-misplace. Okay? So these are nursing questions, pero ibibigay ko na lang siguro yan sa quiz. Okay. Sorry guys. Bakit na-misplace? So additional for UTI. Okay. Yan pa din. So na-discuss naman natin ito. Okay. So now let's proceed to hematologic and immune systems. Okay guys, 5 minutes lang na break ha. Mag-bladder break lang muna ako. Saglit lang ha, 5 minutes. Okay, you can also have your bladder break and stretch muna. Kasi medyo masakit na din yung lalamunan ko guys. Okay, 5 minutes bladder break and stretching. Okay, so now let's continue with our discussion on the most common hematologic and immunologic diseases among preschoolers. Okay, so you know very well that the hematologic and immune system is consist of blood and blood-forming tissues and structures such as the lymph nodes, the thymus, okay, ito, the lymph nodes, which are located in many parts of the body, okay, the thymus, spleen, and the tonsils. Okay. So both of these systems are very important also to consider, di ba? So lahat naman ng mga systems are very important, pero in our discussion dito sa hematologic and immune systems, we will be identifying what are the most common problems among preschoolers concerning sa blood and sa immune system. Okay, this is just a review, guys, ha. The blood is composed of several components such as the erythrocytes or what we call the RBC. Okay. So, ito yung mga RBCs. Okay, leukocytes or the WBCs. Okay. WBC. Ay, sorry po, guys. Sorry. Okay, which includes the lymphocytes, monocytes, granulocytes, and these participate in the immune response. Okay? Diba, if you have infection, ang unang-unang tinitignan ng mga doctors will be the WBC in general. Because if you have a very high WBC, that means that you have, okay, a current infection. Okay? Diba, ang normal range of WBC is only 5 to 10, okay, cubic millimeter. Pero, pag ang WBC mo is already 10 and above, okay, that means meron ng, sabihin na lang natin 10.4, okay, meron ka ng mild infection. Okay, pag naging 12 or even 14, okay, medyo sabihin na lang natin na, okay, there's already severe infection that may lead to septicemia or sepsis. Okay, napaka-importante, guys, yung leukocytes and WBC because they serve as the soldiers of the body, di ba? Okay, next will be your thrombocytes or yung very popular sa atin, common na alam natin na mga platelets. Okay, which are very important in clotting. Okay, especially pag may mga sugat tayo. Okay, napaka-importante po yung function ng thrombocytes or your platelets. Okay, by the way, guys, okay, mataas na naman yung incidence na, or tumataas na naman yung incidence rate natin ng dengue. So please be very careful. Kasi meron na akong nakitang mga nagpo-post ng mga dengue, na ganyan. So please lang be careful, ha? Okay? Next is your plasma or the fluid part of the blood, which carries antibodies and nutrients to tissues and carries waste away, okay, from the body. Okay? So, unahin muna natin ang sa immune system naman, okay? Meron tayong different types of immunity. Okay, so unahin muna natin yung natural or innate immunity. I know this is already discussed to you in your anatomy and physiology class. Okay, so this is just a review, guys, ha. So yung natural innate immunity is usually divided into two. Okay, we have the natural acquired active immunity, wherein the immune system makes antibodies after exposure to disease. Like for example, nagkaroon ka ng chickenpox. So, because of your exposure to the antibodies, okay, that causes chickenpox or even measles for that matter, yung mismong yung katawan mo mismo, okay, yung nagpo-produce ng antibodies, okay, to counteract yung antigen na yan. Okay, so it requires contact with the disease. So kailangan na magkasakit ka muna before or magkaroon ka muna ng exposure to the antigen before your body will produce antibodies. Okay, so ito yung parang, tingnan natin itong part na to. For the active, antigens enter the body. Naturally, body induces antibodies and specialized lymphocytes. For passive, naturally acquired passive immunity naman, okay, ang very common na example natin dito, the antibodies are passed from mother to the fetus via placenta or to infant via the mother's milk. Okay? So, yung pa naman natin dito, description naman natin, there is no active immune process involved. The antibodies are passively received through placenta. Okay? Yung IgG, and then yung sa colostrum natin, yung IgG. Okay? Immunoglobulin. Okay, so that is for natural immunity. Natural acquired active and the passive immunity. Okay, now let's proceed also to artificially acquired immunity. Okay, number 1 is artificially acquired active immunity, wherein antigens are introduced in vaccine. So examples natin dito yung mga nare-receive natin ng mga vaccines, and the body produces antibodies and specialized lymphocytes. So there is introduction of antibodies or antigens, I should say, through vaccination, and then saka magpo-produce yung katawan natin ng antibodies and specialized lymphocytes. For passive, artificially acquired passive immunity naman, preformed antibodies in immune serum are introduced by injection. Ulitin ko, preformed antibodies in immune serum, okay, are introduced by injection. Okay? So those are the different types of immunity. Okay, so let's start first with, sakon muna tayo guys ha, sa blood. Okay, blood disorders. Number 1 is hemophilia. Okay, hemophilia. Okay, so this is an X-linked recessive inheritance. So, di ba, pag sinabi nating wait lang guys. Okay, so we have previously discussed na dito, di ba, yung X-linked recessive inheritance during our discussion ng genetics and genetic counseling. So, for hemophilia, this one results in the deficiency of one of the coagulation factors. And this is usually an X-linked recessive disorder, and the cause is usually genetic in nature. So, ibig sabihin na ipapasa siya from the parents to their children. Okay? So, let's take a look at this example. So, for this example, the mother is a carrier. Okay, carrier lang po siya, but the father is unaffected. So, sa kanilang offspring, since the mother is affected, kasi nga X-linked po siya. Okay? X-linked. So, who will be affected here? Will it be the male or female children? Miss Manuel.
Ma'am, yung male children.
Inheritance.
Ma'am, yung male po.
Okay. Bakit kaya yung male? Pero hindi naman lahat, guys, ha? If you notice, hindi naman lahat, di ba? So, dito, sa first one, kung kunwari, 4 yung anak nila, 2 babae, 2 lalaki, okay? Ano nga ba ang sex chromosomes for male? XX, XY. Pag male, XX ba sila XY? Miss, sino nga yung tinawag ko kanina? Miss Manuel.
XY po.
XY ang?
Male po.
How about XX?
Female po, ma'am.
Sure ka?
Yes, ma'am.
Oh. So bakit dito sa natin dito sa example natin dito, okay. So dito sa first, yung first daughter, carrier daughter siya. Dito naman, affected son. Okay? Which means, nagmanifest sa kanya. Pag kunwari, later on, masusugat siya. Diba? Ang pag sinabi kasi nating hemophilia, konting sugat lang, there is already massive bleeding. So, ito talaga yung patient na affected. Okay? Ito naman yung unaffected daughter and unaffected son. So, based from the percentage of offspring who is affected with X-linked recessive inheritance, since recessive lang naman kasi siya, guys, okay? So, you notice that for the offspring, there will be one carrier, okay? One carrier, one affected son, okay? And one unaffected daughter, and one unaffected son. Okay? Okay, kung kunwari, yung mother naman ang unaffected dito, okay? And then yung father ang affected, or he carries the gene that causes hemophilia, okay? You notice, guys, na dalawa yung daughters niya na dalawa will be carriers, and the sons will be unaffected. Okay? Kasi syempre recessive lang naman talaga siya. Okay, so this is an X-linked recessive inheritance. Okay, so we have different types of hemophilia. We have hemophilia A, okay, hemophilia B, and hemophilia C. And yung isa is parahemophilia. So let's start first with hemophilia A. Okay, wherein there is deficiency of factor 8. Okay, and this one is the most common type of hemophilia. I repeat, hemophilia A is the absence or deficiency of factor H, which is the most common type of hemophilia. Hemophilia B naman, okay, if the deficiency is factor 9 or yung Christmas factor natin. Okay? So, tingnan natin yung description dito sa picture natin. For Christmas disease or hemophilia B, this is also known as royal disease and factor 9 deficiency. Diba? Palagi nating ina-associate kasi, maalala ko noon, na palagi nilang ina-associate yung hemophilia as a disorder which is only common to royal families. Okay? So, this one is true kasi nga with hemophilia B, okay, diba, very common din siya talaga. Kaya nga sinabi dito na this is also known as the royal disease and factor 9 deficiency. So this is a rare genetic bleeding disorder, okay, wherein the blood does not clot properly, which leads to prolonged or excessive bleeding. So kahit konting sugat lang yan, okay, sir, since there is deficiency of factor 9, okay, pwedeng maging prolonged or excessive yung bleeding ng client. Okay? But this is also considered as an inherited X-linked recessive disorder that results in deficiency of plasma coagulation factor. factor 9. So, syempre, ang pinaka-importanting consideration natin sa mga patients with this condition is that we really have to avoid kahit na mga konting sugat lang or even prick because this may eventually lead to prolonged bleeding. Kahit sabihin na lang natin siguro na, prick lang naman yan. Pero kung tuloy-tuloy yan, like for example, 24/7 na hindi nagkaroon ng pag-stop ng bleeding, okay, definitely, magkakos siya ng hypovolemia or hypovolemic shock that may lead to the death of the patient. Okay? For hemophilia C naman, ang deficient naman sa mga patients na ito is your factor 11. Okay? Tinatawag din siya na Rosenthal syndrome. Okay? Rosenthal syndrome. Okay, so dito sa table natin, so nakalagay dito yung mga types. We also have here on the second column the factor deficiency or kung ano yung mga factors that are lacking, okay, or mababa, okay? And then inheritance. For hemophilia A, X-linked, and then for hemophilia C naman, autosomal recessive, and for parahemophilia or tinatawag natin na ang factor na deficient sa kanila is yung B5, autosomal recessive din ang type of inheritance dito. Okay, so what will be our assessment findings? What will be our assessment findings for patients with hemophilia? Okay, so these are the most common assessment findings. Bleeding into the throat, mouth, and thorax. Okay, is very common, okay, among patients with hemophilia. Okay, there will also be hemarthrosis. What do we mean when we say hemarthrosis, Miss Luzon? What is hemarthrosis? Oh, andyan na sa picture. Hemarthrosis is, you know, Miss Luzon, saan matatagpuan yung bleeding pag sinabi natin hemarthrosis?
Ma'am Lucero po.
Okay, sige, Miss Lucero.
Ma'am sa joint po.
Okay.
Hemarthrosis sa bleeding into a joint po, ma'am.
Okay, so hemarthrosis is bleeding inside the joints. Kaya makikita natin dito sa client na to, di ba? Nagkakaroon siya ng hematoma. Siyempre, because of the accumulation of blood na din in this part, okay, which that is affected. So definitely, the patient will complain of joint pain and inflammation. Okay? You may also observe multiple bruises without petechia. So, very common sa kanila na kahit konting nauntog lang yung kamay or na-pinch mo lang ng konti yung kamay, nagkakaroon na sila ng mga bruises. Okay, without petechia. Peripheral neuropathies from bleeding near peripheral nerves. Okay, prolonged bleeding after circumcision. So, syempre, pag nagpa-circumcise ang mga bata na may ganitong condition, kailangan with assistance talaga ng mga doctors kasi baka any moment hindi na mag-stop yung bleeding and then this may lead to profuse bleeding and hypovolemia. Kaya kailangan meron palaging medication at the bedside, okay, para pag nagkaroon na ng bleeding, okay, or may mga prophylaxis na tayo na mga binibigay, okay, before the patient will undergo any surgical operation. Okay, so diagnosis, the patient will undergo blood examination, especially yung PPP or yung prolonged partial thromboplastin time to determine kung gaano katagal yung clotting time ng patient natin. Okay? Kailangan mag-undergo muna siya ng ganyan para ma-determine nila what will be the common interventions prior, during, and after procedures that should be done to our patients. Okay, so what are the most common nursing diagnoses for patients na merong ganitong condition? Siyempre, there will be risk for injury. Talagang risk for injury sila kasi di ba, yun nga sabi natin, konting sugat lang, this may lead to massive bleeding or profuse bleeding. Okay, not only outside the body, pero pwedeng inside the body like hemarthrosis, bleeding inside the throat or mouth. Okay, and then risk for deficient fluid volume. Siyempre, definitely, pag nagkaroon ng profuse bleeding, this may lead to deficient fluid volume. Okay, pag mayroong ganyan, it can lead to decreased cardiac output, and pag mayroong decreased cardiac output, alam nyo naman na, di ba guys, na decreased cardiac output is also associated with decreased circulating blood volume, secondary to hypovolemia. Okay. Okay? So, what will be the treatment then? So, avoiding aspirin, sutures, and cauterization which may aggravate bleeding. So, any surgical procedure for that matter, siguro we have to avoid. Pero kung talagang kailangan ng patient ng mga ganitong surgical procedures, definitely, it should be with maximum assistance of mga doctors natin to prevent heavy bleeding or yung hypovolemia. Okay? Blood transfusion is if necessary lang naman, kung talagang hindi mo mapigilan yung bleeding niya, profuse talaga yung bleeding, and it is very important for the patient to receive blood products like PAC-RBC or whole blood, mga ganyan, or platelet, kailangan nating ibigay. Okay? To save the patient. Okay. Cryoprecipitate administration should also be given. Administration of fresh frozen plasma or yung FFP na tinatawag natin. Promoting kung ano, guys, kung ano yung needed. Sometimes kung sa mga patient naman na for blood transfusion, kung ano lang yung needed na component ng blood, yun lang usually yung binibigay natin. Okay? Pero in cases, like for example, sa dengue, good example is dengue, hemorrhagic fever, di ba? So, usually, ang nawawala sa atin, okay, ng lacking will be, ang sobrang baba will be your platelet. Okay, yung platelet count. Therefore, you need to transfuse platelet, okay, to the patient. Okay, parang ganun lang. Okay, no need for RBC kasi okay naman yung kanyang RBC count. Okay, promoting vasoconstriction during bleeding episodes by applying ice, pressure, and hemostatic agents. Okay, so this is very important, guys. Siyempre, in your BLS, siguro naman nag-BLS na kayo or aware na kayo kung ano yung mga common or yung mga basic na ginagawa natin, okay, to address problems such as this, diba? So, napaka-importante, guys, yung ice application, applying pressure on the bleeding site, and of course, hemostatic agents, such as yung example natin is your tranexamic acid. So, yun yung binibigay natin to stop the bleeding. Okay? Okay, so pwede din aside from that, okay, sa mga hemostatic agents natin, desmopressin, to prevent release of factor VIII in individuals with mild or moderate hemophilia A. Okay? So, aside from those, we also have to include monitoring of vital signs and INO, which is very important para alam natin kung normal pa ba yung vital signs ng patient natin. Kasi remember, pag mayroong hemophilia, they lose blood, therefore, they are very prone to decreasing blood pressure. Diba? So, pag nagdi-decrease na yung continually na nagdi-decrease ang kanyang yung nakukuha mong blood pressure, okay, it may suggest hypovolemia already. Okay, so, it warns you pag na-check mo palagi yung vital signs. Okay? And then, iron monitoring. Because in cases of hypovolemic shock, di ba, nagkakaroon din tayo ng oliguria or decreased urine output. Okay? Assess cerebrovascular status and check for signs of bleeding. Okay? Measure the joint circumference and compare it to that of an unaffected joint to assess for bleeding into the joint pag may mga hemarthrosis. Kasi di ba, baka mamaya mistakenly ang tawag mo dito, sabi mo na, baka ito is lang, arthritis, mga ganyan. Pero yun pala, hindi ka aware na meron palang hemophilia yung patient mo, di ba? So, dapat alam mo yung history din ng patient kung may ganito ba siyang condition. Para, pag nagkakaroon na tayo ng mga complaints of joint pain, inflammation, ganyan, alam mo na yung kailangan mong gawin. Okay? Note swelling, pain, or limited joint mobility. Okay, di ba common yan na na-assess natin sa mga patient na may arthritis. Okay, may mga gout. Okay? Changes may indicate progressive decline in function. Okay, so that, syempre, di ba pag recurrent na nagkakaroon ka ng bleeding in the joints, okay, it will definitely cause injury to that part, which may cause a decline in the function of that specific extremity, affected extremity. Okay? Okay, sa mga bata, pad toys, and especially pag kunwari hindi child-friendly sa bahay ninyo, ang daming mga pwedeng mag-cause ng trauma, okay, or skin irritation or injury, pad toys and other objects in the child's environment to promote child's safety and prevent bleeding. Okay, recommend protective headgear, okay, soft foam, toothpicks instead of bristle toothbrushes, and parang ito guys, yan. Diba kasi normally, ang ginagamit natin ay mga toothbrush with bristles. Okay, pero dapat sa kanila hindi because this may initiate yung bleeding in the gums. And stool softeners as appropriate to prevent bleeding. Kasi diba if you are constipated, like kung kunwari ilang days ka nang hindi tumatae, sobrang constipated ka na, diba may mga times na nagkakaroon din ng irritation in the anal canal which can lead to bleeding. So, that can be one source of bleeding sa mga patient na may hemophilia. Discourage abnormal weight gain which increases the load of joints. Yan. Diba marami na ngayon ang mga obese. Okay? Due to our sedentary lifestyle. Especially us, diba, na naka-online class. Diba, most of the time naka-online class tayo. Okay, hindi na tayo tumatayo sa ating mga gaming chair, okay, or kung saan tayo nakaupo during online classes, saka lang tayo tatayo pag ihi, kakain, kung minsan nga kakain ka na lang, doon na lang sa may table mo mismo for your online class, mga ganyan. So, we have to do regular exercise then and eat healthy diet to prevent, encourage, of course, yung mga parents and yung mga children to maintain normal, ideal body weight to prevent yung hemarthrosis. Okay? And so, when bleeding occurs, again, nakikita nyo dito, ito yung ice pack natin. Okay, nakita nyo din dito, you have to elevate the extremity above level of the heart to help stop bleeding. Yan. So, elevate the affected extremity above the heart to decrease circulation to affected area and promote venous return. Immobilize the site. Okay. Apply pressure to the site for 10 to 15 minutes to stop the bleeding. Okay, kunwari meron kang clean, kunwari nasa community ka or wala ka sa bahay, if you have clean handkerchief there, so pwede mong gamitin yan, ilagay mo dun sa may bleeding na area and then apply pressure for 10 to 15 minutes. Decrease anxiety to lower the child's heart rate. And, okay, how are we going to decrease anxiety level of children na nagkaroon ng mga sugat? Okay, kindly give example, Miss Lunag. Diba, medyo mahirap kasing gawin yan, especially pag ang client mo ay mga nasa pedia ward ka. So, how are you going to stop yung pag-iyak ng bata. How are you going to decrease anxiety?
Ma'am, siguro po kakausapin ko muna siya para ma-build yung rapport before ko unti-unting i-explain sa kanya in a way na maiintindihan niya or tatahan siya, ma'am.
Okay, so kakausapin mo siya. What if yung patient mo is 1 year old?
Ma'am,
What is the best way for you to stop yung pag-cry ng patient?
Ma'am Luzon.
Okay, so yung sinabi kanina ni Miss Lunag ulit yung kanina, sorry.
Lunag po.
Okay, si Miss Lunag, okay, tama din. You have to get muna yung trust ng mga client natin, di ba? So that's the initial thing to do. Okay, pero ano pa after that? After you get the trust, okay, Miss. Sorry ulit, sino yung magre-recite?
Ma'am Luzon, ma'am.
Miss Luzon. Sige, we go back to Miss Luzon.
Ma'am, i-divert po yung attention ng bata, kunwari, bibigyan po ng laruan, ma'am.
Okay, you have to perform diversional activities. O, di ba? May mga nakuha na kayo sa NCP making nyo. Diversional activities such as giving the child yung favorite toy niya. Diba? O, ano pa? Sa mga bata, sino sa tingin ninyo ang sino yung tao talaga na magpapatahan sa kanya, na kailangan palaging nakikita niya?
Mother po, ma'am.
Okay, sige, Miss, sino to?
Gabehan po, ma'am.
Miss Gabehan. Okay, so make sure na pag mga ganitong situation na, make sure that the primary caregiver, okay, who is the mother or the father or kung sino yung talagang closest to the child, should be always at the bedside. Okay, kasi syempre, malaking tulong sila para ma-decrease yung anxiety or separation anxiety ng mga bata. Okay? Apply ice to the side to promote vasoconstriction. Okay? Huwag kayong mag-apply ng warm compress kasi the more na magkukos ka ng bleeding. Okay? It should be apply ice pack to the affected extremity or yung kung saan yung site na nagkaroon ng bleeding. Okay? Way to treat hemarthrosis, immobilize the affected extremity, okay, by using yung mga elastic bandage, or di ba meron tayo ngayong mga conden, yung mga high-tech na mga nilalagay sa mga joints to immobilize the part that is affected. Okay? Immobilize the affected extremity and elevate it in a slightly flexed position to prevent further injury. Decrease pain and anxiety. So we already discussed that a while ago. How do we decrease anxiety? Sa pain naman, pwede ding diversional activity. And then, pwede din naman magbigay ng mga medications. Diba? Kasi that is what we usually do in the hospital. We administer analgesics as prescribed by the doctor. Avoid excessive handling or weight bearing for 48 hours. Okay? Begin. So, kung meron siyang mga crutches doon, okay, to avoid too much weight on the affected joint, so, pwede mong ipagamit sa kanya yun. Ha? Meron naman tayong mga sizes ng mga crutches. Especially kung kunwari ang client mo na dito ay preschool age or hindi pala, sorry guys, kasi nasa preschool tayo, sorry. Okay, meron naman tayong pwedeng ipasadya ng mga crutches for the specific age of our client. Okay? Or mga supporting na support equipment to avoid too much pressure on the affected extremity. Begin mild range of motion exercises. Okay, gaya ng ginagawa ni ate dito. Mild range of motion exercises after 48 hours to facilitate absorption and prevent contractures. Kasi ito ang pinaka-common na problem natin sa mga, kunwari, merong mga inflammation, pain, di ba? most of the time, ayaw na natin galawin kasi ang sakit-sakit. So, at least man lang, magbigay tayo na we have to begin with mild range of motion. Passive ROM or pwedeng active ROM din after 48 hours to facilitate absorption and prevent contractures in the affected area. Okay? So, HEMA naman tayo. Okay, yung mga blood problems natin, so very common, hindi lang sa mga preschoolers, even in every stage, in every age of development. Di ba? Kahit mga matatanda, common din ito. And even sa mga adolescents, di ba? Sa mga nasa reproductive years pa lang nila, very common ang iron deficiency anemia. Ha? Especially sa mga girls. Kaya nga we always encourage women during our reproductive years, pag sinabi natin reproductive year, yung nireregla pa lang tayo, to take iron-rich foods and iron supplements in order to prevent this condition. Which is iron deficiency anemia. So, iron deficiency anemia is the most common nutritional anemia during childhood. Okay? IDA is also characterized by poor RBC production. It occurs most commonly when the child experiences rapid physical growth. Di ba meron tayong age of development wherein very rapid ang kanyang physical growth. Okay? Di ba pag nasa infancy, okay? And then, after infancy, parang may slight na decrease. And then, after that is nagkakaroon ulit ng surge ng physical development. Parang ganon. So, during this time, kailangan natin ng i-increase yung required daily allowance or intake natin ng foods that are rich in iron or mga supplements natin. I know you already discussed that in your nutrition and diet therapy class. So, I hope that by now, alam niyo na kung ano yung mga foods that are rich in iron. Para pag nag-health teaching kayo sa mga patients nyo in the hospital, alam niyo kung ano yung mga foods that you are going to encourage them to eat. Especially pag ang case ng patient mo is IDA. Okay? Yan. Aside from rapid physical growth, it can also be attributed to low iron intake. Yan. Sa mga, di ba kasi ang iron, ang mga green leafy vegetables, talagang alam na natin yan na rich din in iron, folic acid, mga ganyan. So, may mga bata talaga din. Di ba? I don't know kung pati hanggang ngayon may mga ganito sa inyo. May mga tao din talaga or may mga bata talaga na kahit anong gawin natin, hindi sila mapakain ng gulay. Diba? Especially kung kunwari hindi naman can afford yung family na yon, tapos very choosy yung mga anak. Syempre yun lang ang afford ng mga parents na bilhin. Aside from other sources of iron, wala na talaga. They are very prone to iron deficiency anemia. The inadequate iron absorption or loss of blood. Kung kunwari meron tayong problems with the absorption or mga medical conditions that can actually affect yung ability of the body to absorb iron. Okay? Or kunwari nagkaroon tayo ng bleeding. So those are especially sa mga babae. Sabi ko kanina, very common din ito sa mga females na nasa reproductive years pa. Okay, I hope that all of us here, okay, mga girls, are taking ferrous sulfate once a day. Kahit once a day lang, guys. Okay? Para naman ma-replenish yung iron losses natin during our monthly period. Okay? And okay, so causes, blood loss, inadequate dietary intake of iron, less than 1 to 2 milligram per day. And this may occur following prolonged unsupplemented breastfeeding or bottle feeding of infants. So the more na naglulus ka ng iron, the more na kailangan mong i-increase yung required daily dietary intake mo, okay, of iron. Kasi may nabibili naman tayong mga iron supplements, di ba? Meron naman tayong mga affordable iron supplements na yung isang bottle which is 90 pieces ata yun, 90 tablets, parang mabibili mo lang ata siya ng nasa 80 pesos to 100 pesos. Diba? Okay, yung mga generic na iron supplements natin. Okay, and then sa mga buntis naman, di ba, it is usually given for free sa mga barangay health centers natin. And then, it may also be attributed to iron malabsorption, secondary to chronic diarrhea, and celiac disease. So, we already discussed this previously, yung celiac disease na to. So, this is, it causes yung, dito, problems with absorption. Ito yung mga causes of IDA. Ayun yung bumaba. Okay? So for the assessment findings, I'll just finish this one. It's already 10:22. Initially, it is asymptomatic. Kasi hindi naman agad-agad na pag meron kang iron deficiency anemia, agad-agad ay sobrang, magkakaroon ka na ng dizziness, fatigability, ganyan, or pallor. So, gradually, initially, it is asymptomatic, and then gradually, pag sobrang baba na yung RBC mo, doon mo na lang ma-feel yung mga signs and symptoms of anemia. Okay? For advanced anemia or severe anemia na to, the patient or the child will experience the following. Easy fatigability. Okay, konting lakad lang, sabihin na lang natin, 10 steps lang. Okay, or konting laro lang, in just few minutes, pagod na yung bata. Okay, that could be one sign of anemia. Listlessness, okay, pallor. Okay, very common yan, di ba? Palagi yan ang ina-associate natin with anemia. Okay, check natin yung conjunctiva, i-check natin yung palm, okay, kung pinkish ba siya, mga ganyan. Okay, yung mga buccal mucosa, pag pinkish. Okay, pero pag sobrang pale, okay, di ba, you always associate it with the presence of anemia. Susceptibility to infection. Okay, kasi remember guys, it has something to do also with immunity. Okay? So, pag anemic ka, you're very prone to contract different diseases. Okay? Tachycardia. This is a compensatory mechanism, guys, ha, di ba? Compensatory mechanism ito ng katawan, yung tachycardia due to anemia. Okay, numbness and tingling of the extremities. Okay, and vasomotor disturbances. So these are the most common assessment findings that you can observe if you are assessing a patient with IDA or iron deficiency anemia. Okay? Ano yung mga diagnostic test results? Okay, so sometimes aside from the CBC, yung ating complete blood count wherein you can check for the hemoglobin, hematocrit, WBC, diba? Yung differential counts like neutrophil, eosinophil, basophil, okay, yung mga yun. Okay, platelet, okay, nag-undergo din sila ng bone marrow studies. Okay, which will reveal depleted or absent iron stores and normoblastic hyperplasia. So guys, what do we mean? Okay, sige si Miss. Kasi alam ko na-discuss nyo na to sa anatomy dati Okay, I just don't know kung na-retain. Okay, Miss Lozano, what do we mean when we say saan na ngayon? Normoblastic hyperplasia. Anong ibig sabihin nun, Miss Lozano? Anong ibig sabihin ng, anong nangyayari when there is normoblastic hyperplasia? O, saan na si Miss Lozano? Hindi na, kahit ito lang tapusin natin, guys. It's ready to, kuha Miss Lozano. What is normoblastic hyperplasia? How do we define that?
High
Meron pa ba si...
level of immature red blood cells.
Buti na meron dito si Stans na laging nagka-catch sa inyo. Okay, ulitin mo nga, Stans. There is
High level
level
of immature red blood cells.
Okay, there is high level of immature red blood cells. So remember that, kunwari, maraming ang RBC pero immature naman siya, it will definitely not carry enough oxygen to be delivered to the different parts of the body. Okay? So hemoglobin, hematocrit, and serum ferritin levels are low. Okay, and then the mean corpuscular hemoglobin is severely decreased in severe anemia. So ito usually yung MCV or MCH na tinatawag natin. If you will undergo CBC, di ba may mga iba kasing mga hospitals na instead na makikita mo doon hemoglobin, hematocrit, ganyan, may mga ibang nilalagay silang mga description like MCH or that means your mean corpuscular hemoglobin. So makikita natin doon na very low, okay, ang kanilang MCH or mean corpuscular hemoglobin. Pag sinabi nating mean corpuscular hemoglobin, that is an estimate of the amount of hemoglobin in an average red blood cells. Okay, so how do we get that? Okay, you have to get for the hemoglobin level in grams per deciliter divided by RBC in million times times 10. So, ang normal range usually ng MCH natin is 27 to 32 picograms. Yan. That is the MCH. Usually, ang gumagamit ng MCH, guys, is sa kwan. Nakikita ko na gumagamit nito is sa MMG. Kasi na-try ko nagpa-CBC sa anak ko dati doon. Ang ginagamit nila is yun, MCH, MCV, ganyan. Pero sa ibang institution, ang nilalagay lang nila doon is hemoglobin, hematocrit, platelet, ganun lang. Okay? So, it's already 10:30, guys. So, we'll continue with our discussion tomorrow. Please read in advance because I might give a post-test right after we discuss the remaining slides for this PowerPoint presentation.